Good afternoon, dear participants. We are about to start our evening session of day 3. We have with us our speaker, Dr. Anweshak Das, who is a consultant psychiatrist at a psychiatric clinic, Gauhati, Assam. He'll be enlightening us today on importance of positive mental health and emotional well-being, the need of the hour. This was supposed to be a joint session by Dr. Anweshak Das and Ms. Jayashree Das, but unfortunately, our second speaker of the day is not in good health and she is unable to join us. So it will be carried on by Dr. Anweshak Das, who will try to cover up the session. So I welcome Dr. Anweshak Das to this platform amidst us, to this ATAL FDP on stress management. And I would now like to hand over this session to him so that he can carry forward. Dr. Anweshak Das, please take over the session.
Yeah. Am I audible and visible both? Is the video clear,
Yes,
I guess? Okay. A very good afternoon to all the participants, and my sincere thanks to the department who is organizing this stress management, rather 3 to 4 days session on management, which is the need of the hour basically. And my sincere thanks to Aradhana Mishra, who has given me the opportunity to be a part of this 3. And at the very outset, before I start my presentation on emotional well-being and positive mental health, basically it was supposed to be a joint session, me and my wife, Jayashree Das, who is a consultant clinical psychologist. But since the last 5 days, we both were very unwell. We had fever, cough. We did our corona test, which fortunately came out to be negative, but she's still recovering and she's still in a very bad shape with fever up and down and cough. Obviously, her voice has gone for a toss. So she is not in a proper state to deliver her lecture. So my sincere apologies to the organizers of this conference and also to the participants. So it will be a cut short session. However, after the end of my session, I'll just give a brief of what Jayashree was about to present. And if I go through the 3 to 4 day session, I see a lot of perspectives of how to manage stress through various modes like nutrition, exercise, yoga, meditation. So in a nutshell, Jayashree was also supposed to speak about all those in a psychological perspective. So I guess it will not be a huge loss for you, though I'll also chip in what she had to present actually. Before I start my lecture today, the need of emotional well-being and positive mental health. Again, coming back to the schedule, the very first day, also Chandana, Miss Chandana, she is a psychologist in another Pratiksha hospital. She also gave the brief perspective about positive mental health. But me as a psychiatrist and as a clinician or as a doctor, why I stress upon the need of positive mental health and why emotional well-being is needed and why it is the need of the hour basically, and why it is of utmost importance that we give prerogative to this spectrum in our life. I'll stress on that, and how if there is a loss of emotional well-being or if there is a loss of positive mental health in our own life, in our day-to-day activities, how it can hamper our daily social activities, our relationship with our families, friends, our partners, our colleagues, our activities in our family, in our office, or in our school, whatever job we may do. I'll be stressing upon that, and why awareness is needed basically nowadays, and the need why awareness is needed to keep a positive mental health. As a doctor, why it is important, I'll stress on that. And I'll not speak about much of the clinical terms. I'll not speak about much of the scientific terms in medical nosology. But as non-doctors, how you teachers or professors or whatever field you may be, you need to be aware of what are the subtle signs that someone might be suffering from mental illness and they need to seek help. Why seeking help from a professional mental health is important. I'll stress upon that. Uh, is my presentation visible? Hello?
Yes, it should come. Yes, it's visible.
Okay. Yeah. So when Aradhana first contacted me, she asked me to give a topic. So I thought this will be a very appropriate topic, uh, going by the difficult emotional phase we are all going through because of the current pandemic situation. So I thought, why not give a brief and give a bit of awareness on why emotional well-being is needed. Basically, so I thought of presenting it, the importance of positive mental health and emotional well-being, which is the need of the hour. In fact, I believe, and I strongly believe, and we all psychiatrists or as professionals of mental health background, we all believe that in fact it is just not the need of the hour basically, and it is the need of life actually, right? It is our need of life, because pandemic situation is just a temporary phase. Hopefully by 2 3 months it will uh, go off. That's what we are praying. So but we need to be in a proper state of healthy mind, healthy emotion, healthy positive state of mind throughout our life to carry on our activities. So before we go on to see what positive mental health, I like to just uh, describe what health is. Basically, most of you might be knowing that this is the classical definition given by WHO. It is the state of total physical, mental, and social well-being, and not merely by the absence of a disease. That one it just says that if one does not have any diabetes or any hypertension, or if one is not suffering from any life-threatening disease, that he is in a good state of mind or good state of health. Basically, he needs to be socially active. He needs to be mentally active. He needs to have a positive state of mind to be called as a healthy human being. And WHO has given two most important statements. It says that there is no health without mental health, and having a healthy mind is just as important as a healthy body. So what is mental health basically? So if we classically define mental health, it's defined as a state of successful performance of our mental functions, which results in our productive activities, whatever activities we do. Me as a doctor, a teacher in his teaching profession, a plumber in his plumbing job, architect in his architectural world, whatever area one is supposed to work. So that should result in a productive activity, and most importantly, fulfilling relationship, as I have already told in the beginning, with your family, with your spouse, with your children, with your colleagues, siblings, friends, everyone. And the last statement which I always stress upon, the last part of this definition, it is the ability to adapt to change and cope with the adversities. Because we see there will be challenges in life, as the proverb says that life is not a bed of roses. Life will be always will be of ups and downs, right? We can't always pray for a beautiful stable life. There will be adversities, there will be challenges in our day-to-day life, and but how to face those challenges, how to come out of that adversities, and how to bounce back and be normal in our life again is what a good mental health needs. So our mental health has three dimensions basically. It's the thoughts, what we think. The thoughts are obviously given rise by our emotions, how we feel about a situation, how we feel about a person. That emotion gives rise to certain thoughts, and with the cooperation and with the mixture of the emotions and thought, we behave in a certain way to a certain situation or to a certain person. So if we have good school of thoughts, if we have good school of emotions, obviously if we have a stable, not necessarily good every time, but if you have a stable thought and a stable emotion, we will obviously behave in a particular situation with more responsible, with in a more responsible self, in a more responsible way, and ultimately it will give out good performances in our life. So good mental health is just a way of acting right, thinking right, and feeling right. So a person having a state of good mental health will always realize his or her own abilities. Okay, he will know his limitations. He will know how much to achieve, what to do, how not, what not to do, basically. And always I stress upon the always I have already told that it is the ability to cope with the normal stressors of life and work productively. And finally, since we are always working towards the betterment of our society, of our community, if we have a stable set of mental health, we will be definitely going to make a contribution to our community and the nation as a whole. So, what is positive mental health? The main theme of my presentation. A person having a positive mental health will have all the following characteristics. Right? If we can go through one by one, it is the ability to learn from experiences, our past experiences, good or bad, and react to the similar situations to a person. It's the ability to introspect, to examine oneself, and consider a change in ourselves, consider a change of how to tackle any situation, how to tackle any problem in our life. At times, it is the ability to take some risk and tolerate some uncertainties in life, fulfilling relationships with her family. Most importantly, nowadays in our society, positive mental health very much stresses upon the ability to forgive others and oneself. And also mostly in children's, and when we give lectures to schools and colleges, we always stress that the ability to forgive others and oneself comes from the moral virtue of empathy, which we stress upon, just to know the emotions of others, feel the emotions of others, and find out the problems from another's point of view. That is how what why positive mental health is important. Finally, also, with a good set of positive mental health, we should also be able to enjoy whatever recreational experiences we want to enjoy in our life. And finally, as also already said, we can make contributions to our community and our society and our nation. So a positive mental health, someone is having positive mental health, he will have definitely have these characteristics. One very important point, again, we stress upon children's. We tell to parents and we tell to teachers that just to invite the ability to engage in reverie and fantasy, the first point, if you can see, to the children's and students, the basically the toddler age group. Reverie and fantasy is obviously to establish an imaginary capacity to the children's, the creative abilities, so then one can aspire, one can dream of what he wants in life and finally move towards that goal. So that is also an important point of positive mental health. And finally, if we have good set of mental health, if we have a healthy mind, we are definitely going to have a healthy society, and ultimately it will lead to social cohesion, productivity in whatever areas we work on. Finally, and peace and stability of the society very much depends upon the positive mind. Just a bit of what brain is. Our brain controls our mind and behavior. Brain is a organ. Obviously, it is one of the very complicated organs, and it is the highest state of organ we tell, apart from the heart, because it controls our mind and behavior. The brain, through the mind and behavior, controls our thinking, our decision making, our judgment, our logical thinking, basically the memory, our intelligence, the judgment, how to judge a situation, how to judge a person, how to judge an idea, and finally it brings about some constructive and creative ideas. That is what reverie and fantasy is. So the brain, through mind and behavior, and of course I'll tell about emotions in the next slide, mind and behavior controls all these activity. And if we have a proper working capacity of all these functions, the thinking, decision making, judgment, logical analysis, we are definitely going to have a set of positive mental health in an individual, right? Then coming to emotion, what is emotional well-being? If we see emotional well-being and positive mental health, comes in a spectrum. Basically, both are almost the same thing, but subtle differences are there. uh, Emotions are the way what we feel about an situation, what we feel about an experience, what we feel about a person. It might be good, it might be pleasurable, it might be displeasurable for others or to ourselves, and that feeling give rise to the thought process, the cognitive process, how we think of that person or a situation. And that thought process and feelings certainly give rise to some of our bodily arousals, and finally that bodily arousals finally control our behavior towards that situation or experience or that person, right? So if you see the dimensions of emotion, it might be good, it might be, if you can see the slide and the image, it might be a contented emotion, we might be relaxed, we might be calm about a situation, or say we might be very excited, we might be elated, we might be happy about the situation. And when that elation or happiness comes to our mind, that gives rise to some of the bodily arousal. For example, someone has topped in the exam, that will give a positive emotion in him. He will be elated, he will be happy, he will be jumping. So jumping is the bodily arousal. He will behave very cheerfully. And say, for example, someone has abused you, you have become very angry towards that person, it will give rise to the negative emotions. If you can see, you will be upset, you will be stressed, that will give rise to negative emotions, and then you will again behave in a different way, like hitting him or kicking him. So that are negative sets of behavior. So you understand how emotion can control our thought process and our behavior. So we have sets of good emotions. Definitely, we are human beings. It is natural to have both good and bad emotions. But how we control that bad emotions and how we nurture our good emotions and how we uplift that good emotions is what positive mental health and emotional well-being is all about. Right. So ultimately, if we see the characteristics of a person having positive mental health and the characteristics of a person having emotional well-being, is the same. So we can gauge both the things, and if the both emotional well-being and positive mental health works in tandem, you are in a perfect state of mental health, basically. So emotional well-being again is the ability to learn from adversities, is having clear values. You are being optimistic. Self-esteem is one of the most important things that we as mental health professionals stress upon. Never be introvert, never have a low self-esteem, always remain confident, always remain optimistic. And if you have low self-esteem, then definitely that is a characteristic of depression, which I'll be coming on in my future coming slides. Again, you have passionately engaged in whatever activities of your life is. You have a meaning and purpose in life, you have the motivation to go forward in life, you have the motivation to establish long lasting relationship. So if you see, is the if you see the characteristics, positive mental health and emotional well-being is almost the same, right? So it's very important that we have positive mental health and emotional well-being. So again, as the positive mental health is controlled by our brain, our emotions, which is a part of our mind, is controlled by brain. I won't go into the details of the anatomical functions of how the brain controls our emotions, but again, those have neurological and neuropsychiatric implications of how our brain controls our emotions. So everything boils down to the brain as an organ. Okay. So if our brain is not working properly, we will have a whole lot of imbalance in our thinking process, in our perception, how we perceive again a person, situation, or experiences, or a particular person. We'll have abnormal emotions going through. Our bad emotions will oversurge our positive emotions. We'll have negative physical activities and negative behavior. So if the brain and the mind is not working properly, all the six main functions goes for a toss. Okay, and then suddenly we see a person suffering from a mental disorder or a mental illness. Now, just to check you out here, today, whatever I am going to speak about, whatever subtle symptoms of mental illness or why you need to be aware of the mental illnesses, I am only going to speak about the common mental illnesses, right? There is a difference between common and mental illnesses and the serious mental illnesses. Common mental illnesses are what we Day to day, we speak about stress, anxiety, worries, depression, tension. Those are common sets of mental disorder. Those are completely treatable. There are other sets of serious mental disorder, like most of you have heard the name of schizophrenia or bipolar disorder. I'm not going to speak about that because those have different sets of etiology, different sets of causative factors, different treatment strategies. They need lifelong treatment. So I'm not speaking about all those things because common mental disorder is what stress is what depression is what anxiety is, and those are completely treatable and also preventable. That is what we are going to speak about today. So, if I go back to the earlier slide, if our brain and mind are not working properly, we will have a disarray of all these working functions or working capacities like behavior, thinking, perception, judgment, logical analysis, our creative thinking, our emotional thinking, our emotional judgment. Everything goes here and there, and all these are controlled by main brain through the mind by some of the chemicals known as neurotransmitters. Again, I'm not speaking about that. So ultimately, if all these are not working properly or in a tandem or in proper cooperation together, we are going to definitely have some or the other common mental disorder. So if you don't have proper set of positive mental health, if you don't have proper set of emotional well-being, then definitely we are just starting to have or just starting to behave differently, which can be perceived by others. That means that we are going to have some common mental disorder, right? That is why awareness is needed, because we see mental health problem does not only cause the problems to the person or the individual or the children itself. It causes a whole lot of negative influence to the family, and ultimately to the working environment, and ultimately to the society and a community as a whole. And ultimately it will lead to lifelong impairment and have negative consequences throughout our life. So that is why nowadays we stress upon we as mental health professionals give very much impetus upon the early recognition, early identification of the subtle signs that yes, someone is having stress, yes, someone is having features of anxiety, yes, someone is suffering from depression. Go out, seek help, because the earlier you seek help, the earlier you identify the problem, then it's very possible that you come out earlier of the problem, and you can definitely decrease or prohibit the negative influences or the negative impairments in your life. Implementation of mental health initiatives is very imperative. Whatever areas, whatever field you might be working in, be it a school, be it a college, be it a university level, be it then multinational company level, be it the BPO level, we find counselors everywhere. We find professional clinical psychologists being taken up by every sphere of these working areas. We have psychiatrists working in board of MNCs, in board of schools and colleges. Why? Because we need to have mental health programs everywhere nowadays, right? Just to give a brief of why mental health has been given very much, or why mental health programs have been given impetus on, because the number of mental health or patients of mental health or persons suffering from some of the common mental health disorders have increased, and it has shooted up like anything. In 2005, it was only 60 million Indians who had suffered from the mental illness. And again, to stress upon, the only the common mental illness I am telling about: stress, anxiety, depression. However, this is the last survey which was done in India, and it was published in it was done in late part of 2016 and published in 2017. It was done by NIMHANS, one of the premier mental health institutions of our country. It said that from 60 million, it went up to 150 million, right? 150 million Indian aged 18, that means the adult age group, and 7.3% aged 13 to 17 years has suffered from some mental illness. And out of that 150 million, 45 million had depression, right? And the latest statistics which I found last week in one of the newspapers, they said because of the pandemic, again there has been 46% increase in that common mental health disorders. Right. I'd like to tell about the myth there is always the myth that children and adolescents do not suffer from any emotional or behavioral problem. But the fact is that children and adolescents, most of your parents out there, children and adolescents has the capacity to develop mental health disorders. Right from the age of 4, right from the age of 5, anyone can develop mental health issues. So as parents, as teachers, if you are teaching in a mid primary school, you should be aware that yes, your students, your children can also suffer from mental health disorders. We have a specialized branch, child and adolescent psychiatry, which deals with these problems, and the statistics also says that, right? 50% of mental illness begins before the age of 14. That means before the age of adolescent. uh, this is one of the very important slides, or I like to highlight, which I give in every presentation. This is the disability list, or the global burden disease list that has been published by WHO every 10 years apart. You see, in 1990, depression was the fourth major killer disease, but in 2020, it is estimated that it will come up and get the position of second number. So it will be the second killer disease. What's more warranting, that I have not given here, it says that by 2030, it will take up the number one position. That means depression will be the number one killer disease, overshooting diabetes or heart disease or stroke or any cancer. So depression stems from uh, stress and anxiety. So that is why you should be aware of this common mental health disease, and why I have been stressing on the point that why you should have positive mental health, why you should have emotional well-being, because it says that by 2030 it will be the number one killer disease. If not so in 2030, I definitely believe by 2040 it will be the number one killer disease, right? Now, as I have already uh, told you that we are only going to speak about the common mental disorders, and that means stress, depression, and anxiety. Most of you have already gained some perspective of what stress is, how stress develops, how to handle stress from various other speakers throughout these 2 days. But I like to give a clinician's view and a doctor's view of how patients comes to us, and what are the complaints the patient gives us, and how to identify stress, right? Because I'll give those awareness, or I'll give those awareness to you, the subtle signs to you, because you as a part of the society can at least go out and at least identify some of the persons who are suffering from those illnesses. It might be your partner, it might be your children, it might be your colleague, it might be your friend, anyone. It might be a close relative of you, and those signs will be very important for you, so that you help them seek professional help. uh, I'll not go into the details of stress, because as already told, many of you have already got the insight of what stress is. Obviously it is a normal part of our life. Everybody has stress, nobody can run away from stress, right? But what is important is how to adjust to the stress, how to cope with that stress. And one very important thing to cope with the stress is how can we adjust to the particular situation or particular area which has given rise to the stress. So adjustment and coping is one very important factor which keeps away a lot of stressors from our life. So it's very normal, as I have already told. Okay, it's present in everybody's life, and in a comical way, most of our us as mental health professionals, when a patient comes out with mild degree of stress, we say that yes, you are having stress. Just spell it backwards. It's deserts. We all like deserts, like we all like ice cream. We all like pudding. So it's deserts which we should enjoy basically. And if you enjoy your stress, if you handle it in a positive way, definitely people come out of stress. That's what we tell people, but obviously it's easier said than done. And again, I also tell that everybody will have stress. The person who are resting in peace don't have stress. So that is the group. And finally, when you go back to your grave, you won't have any stress, right? So everyone experiences a stress. A bit of stress is not a problem. And in fact, most of you have seen this slide. If not, just again recapitulation that stress is very much needed in our life for the optimal performance. Whatever area we do, are going to give an exam, we should have a bit of stress because to perform better. If we don't have stress, we won't have any activated system in our mind, we won't be alert, and we'll just give a blank exam. And again, if we have high degree of stress, it will lead us to anxiety, it will lead us to disorganization, it will lead us to depression, and again we'll perform very low. But an optimum level of stress is very much important, whatever area we work on. Again, if we have seen this slide in these 2 days, it will be a repetition. We have two kinds of stress: use stress, distress. Use stress is positive stress. Someone is getting married, he has a stress whether the marriage program will be good, how will be adjust with his newly married partner. So that is good stress. Someone is getting promoted, going to a new area, joining a new office. So those are good stress. Those are positive stresses. Again, but distress is something we are very worried about. It gives a lot of unpleasant emotions in our mind. It disturbs our day-to-day activities. That is distress, and that is when you should seek help from a professional. And as I have already told, stress is very normal in our life. Everybody has stress, right? But one thing you remember, when it is very frequent, when it is very intense, it increases day by day, and when it is prolonged, right? These three things are important. When the frequency increases, when it is very intense and it is prolonged, then it becomes a threat to life. And ultimately, this stress will turn out into anxiety, and this stress will turn out into depression. And that is the red sign that you should seek help from a mental health professional. So excessive amount of stress will give way to excessive negative thoughts, negative mood. You will cry, you will shout, you will be irritable, and it will give rise to maladaptive behavior, and it will hamper our physical health also. So stress might be because of various reasons. When it is excess, you will have anxiety, depression, and suicide, which is the ultimate unfortunate unwanted event, right? One thing I'd like to stress upon: stress is there, but everybody does not go on to have depression and anxiety because of the personality issues, because of the coping skills, and also vulnerability issues. There will be some genetic factors, what we inherited from our parents, if there is a history of mental illness in a family. All this depends. If you are an alcoholic, whether you take any substance abuse, or what social support you have to handle those stressors. Right. So coupled with all those factors, if there is excessive stress, ultimately you will go on to have anxiety and depression. So it's a vicious cycle goes on, right? Uh, Stress leads to one another, and I already told the unwanted event, suicide. That is what we, as mental health professionals, strive on to prevent. Recently, just 10th of September, we observed as the World Suicide Day. So it, we keep on telling all these issues, but we as mental health professional again lack the ability in preventing suicides. That's our failure actually. So I've been telling about stress, which unwanted worries or unwanted tension. But what is anxiety basically? See, stress is specific. You need to complete one file. You are not getting the time to complete the file. On top of that, your boss gives you another 10 files to complete. That is a stress, that you have to complete 10 files in 4 hours. That is a stress. You know what it is. It's specific. But anxiety will be more diffuse. If you have overburdening of stress in your family, in your office, in your friendship, in your relationship, all those stress accumulates, and ultimately you will have those mental disorder or mental illness, and then you will turn into anxiety and ultimately depression. It will be more diffuse. You will have more symptoms. You will have more difficulty in overcoming that negative emotions. Okay. As teachers, as professors, as professionals, workload is main cause of stress in various offices and MNCs, and then it is obviously coupled with the maintaining of personal and family life. Most of them have job securities, most of them have financial issues. It might be of various reasons. This is just a nutshell, this is just the tip of the iceberg, I believe. But just for the sake of presenting, I have given the main problems. But there might be n number of causes why a person is going through stress, anxiety, and depression. Uh, Personally, are you suffering from any stress? What are the signs of excessive stress and depression? How stress can lead to anxiety and depression? And I'll just tell you in the following slides. And as I have already stressed upon the point that uh, no, everybody goes through stress, but why only some people come out and to seek help, and why only some people go on to have anxiety and depression? Because obviously the coping skills, the type of personality, how you perceive a situation, how you take care of the situation, how you handle the situation, that depends a lot on the personality, that depends a lot on the coping skills. Obviously gender is one of the issues. Those statistics says that in our books, is though it says that ladies or women suffer from more stress and depression, but personally, as a clinician, I have seen more male gender coming to me, because I believe females are more capable of handling various situations, juggling between household chores, offices, their children. And finally, one very important thing which I stress upon nowadays is the EQ. More than the IQ, you need to have a higher EQ to sustain your life nowadays. That is what emotional well-being is. That is what positive mental health is. EQ is very much stressed upon nowadays. That is why in our school curriculum, me and my wife Jershi has been implementing a plan to propose social emotional learning in children, so as to cope with the stressors of life, how to manage their anger, how to manage a difficult situation, how to handle stressors of exams, how to manage relationship. That is what EQ all depends upon. How to increase the empathy, how to increase the altruistic behavior, so that one can face any adversities in life. Resiliency is one of the important factors. Most of the participants have must have attended yesterday's session of resiliency. I have seen that is very much stressed upon. So EQ, greater EQ is very much stressed upon nowadays, more than higher IQ basically. So it's your own perception of how you process your stress at individual level, right? Now, the following slides I am coming through, which is the main part of my presentation. As clinicians, I want to stress to everybody, every participant, every teachers, every senior out there, that please be aware of the subtle signs of what I am going to speak about in the next 2-3 slides, because this will be very much helpful for you, not as an individual, but as a responsible person of the society, as a responsible person of your family, as a responsible mother, as a responsible parent, as a responsible partner. If you see any of the following symptoms in your near and dear ones, in your staff room, in your family, in your house, please try to speak with the individual. Please try to get help from a mental health professional. As I have already told, excessive amount of stress keeps on piling due to various reasons: work pressure, family pressure, financial issues, and number of issues might be there. Okay, relationship issues, job loss, job security. Those stressors keep on piling, and ultimately the individual loses the threshold level to control those stress. There is a limitation of how one can, like if you stretch a rubber band, it will go up to a certain point, then it breaks. That is how our mind copes with stress. There is a certain level. That threshold level depends upon individual to individual, depending on the personality, coping skills, gender, emotional EQ. And ultimately, when those threshold of stress breaks down, one breaks down into the common mental disorders, like the anxiety or the depression. So you will have all these symptoms bodily. You will have muscle aches, you will have headaches, you will have easy fatigability, you will have breathlessness. Emotionally, you will be irritable, you will be anxious, you will have loss of confidence, you will be depressed, and again, from behaviorally, you will have go on to have excessive smoking, you will have loss of sex drive, you one might go on to take alcohol. Okay, one might be indecisive, one might have all the negative emotions. But patients do not come to us with all these complaints. There are certain complaints with which patients come, and as clinicians, I want to make you aware of those problems. Those are categorized into two parts. First is obviously the internalizing behavior. Internalizing means The person internalizes his problems. He never speaks up to his seniors. He never speaks up to his partner. He never speaks up to his parents. He just keeps the problems within himself. And those problems or those stress, when someone keeps within himself, it piles up, piles up, piles up, and there will be behavioral problem. For example, you will have withdrawn behavior. You see your kid running around, playing around, and suddenly one day you will find snap. He is gone aloof. He has isolated himself in the room. Okay, he will have low mood. He'll have all the somatic complaints. Somatic complaints is what panic attacks and anxiety features are. Suddenly you will have breathing difficulty. You will have body ache. You will have stomach ache. You will have all sorts of physical complaints. Right? There will be disorganized eating habit. Either you will eat more, eat disorganizedly, or you will eat very less. Most of the people who has common mental disorders or who has been suffering from mental disorders has an a very terrible routine of eating. Takes breakfast at 12 o'clock, have lunch at 5 o'clock, and then dinner will have after midnight. And then sleep is one of the very important problems that important features that signifies that someone is having mental disorder. Either there will be no sleep at all, or he'll just lie down in his bed and pretending to sleep. Okay, so if you see any sets of this behavior in anyone you know, kindly take help. What are the other internalizing behavior? Obviously, there will be loss in the interest of pleasurable activities. Earlier, an individual would like to play an instrument, watch TV, see a movie, go out for a movie. He has lost everything. Then there will be fatigue. Most of the children comes up with the problem that, sir, I am having difficulty in concentration. I cannot concentrate. That is a very important feature that, yes, the student is suffering from anxiety or depression. And finally, there will be extreme disorganization. Right, extreme disorganization means our daily routine goes for total disarray. Okay, like I said, we will get up at 12, we will not take a bath, then have breakfast at in the noon, have lunch at in the evening time. So there will be extreme disorganization in our day-to-day routine. There are many examples which I can give. Recently, last month, a very young boy, he was around, I think he was studying in class 4. He was from the Nagaon district. Obviously, we cannot tell the name and the school he is studying. He came, his parents brought us, obviously brought the child to our clinic, and he was having all sorts of physical complaints. He was having stomach ache, he was having certain abnormal movements in his body. He was having pain in his right arm, so as to this effect that he could not even lift the pencil. Right. So neurologically he was fine. The pediatrician, medicine doctors have seen him. Everything was fine, and then finally he was sent to us. And when we assessed, me and my wife, and when we assessed, we found that he was suffering from severe depression. He finally spoke in front of us that last year, just before the lockdown, I think he was promoted to class 4. That he was a child with slow learning abilities. He did not have the full capacity of IQ. He was just borderline IQ. So his teacher asked him to made him stand in front of the whole class, since he was not being able to answer something or he did not complete his homework. He said that you take out the booger of your nose and start eating it every day along with your lunch or dinner, so that it increases your memory. And then the whole class started laughing. So that was an indirect bully on him. So that led to all those physical symptoms, that led to him getting crying spells. And obviously one good factor was that last 5 months he was not going to school again. Since the school was about to open, I think most of the schools have started, he again started to get panic that his school starts again, my teacher will laugh at me again, my friends will laugh at me. So this is how internalizing behavior that child presented with us with depression. Right. So this is how the patient presents to us, and this is how this why you need to be aware of these symptoms. That's done with internalizing symptoms. And then there are sets of externalizing behavior. That means people show to you, the people will you will find by observation that he is behaving abnormally or he is behaving in a different way, right? Earlier, someone was very respectful to the seniors, to the teachers, to his friends. Now he has suddenly become disrespectful. He'll become very inattentive. He'll break rules. Suddenly, there will be anger outbursts. He will become aggressive at times. There will be fight with family members. Suddenly, he will break things. So, and breaking things or becoming aggressive is not a sign of serious mental illness. Even people suffering from depression and stress can have all these aggressive behaviors or irritability or anger outbursts. So you need to be very wary of these symptoms, right? There will be crying spells, there will be irritable behavior, all sort of behavior. And additionally, some people will come to us and directly tell that we are feeling low, we are feeling empty, not being able to enjoy anything. There will be hopelessness. Adults come with to us with loss of sexual drive, okay, severe feeling of guilt, hopelessness, worthlessness, and ultimately, as I have already told, ultimately people who cannot seek help, who internalizes the things, ultimately most unwanted event, unfortunately, suicide. So it's going up. Suicide is the second most important cause of death for adolescent age group. So we need to prevent this unfortunate unwanted event, right? These are the top 10 warning signs of mental illness. That yes, if you have one of these symptoms, that means you are not emotionally in a good state of mind. That yes, your positive mental health is gone for a toss. That yes, you need to seek help. If someone is having one of these symptoms, please kindly go out and seek help. You should you should be wary of all the last two three slides: the internalizing behavior, the externalizing behavior, and these top 10 warning signs you need to be aware of, right? Almost the same things. So basically this is what I wanted to speak about today. This is how, if we can see, if you have positive mental health, if you have good emotional well-being, how productive you can be, and how you can contribute towards your workplace, towards your family, towards your society, and how stress or how anxiety and depression, it starts to develop, can dethrone you of your emotional well-being and hamper your positive health. And what are the symptoms that yes, your emotional well-being and positive mental health are affected? I have given you a brief perspective that you must be wary about, not for yourself, but again, to stress upon as part of your family members, as part of your parenting skills, as part of your teaching skills, as part of a responsible citizens, you should be aware of, right? uh, Basically, I was supposed to end in this slide, and I also have a few slides, obviously. But how to take care of this emotional well-being and positive mental health, that was supposed to be spoken by Jayashree, my wife, who is obviously not doing because of her health issues. So I'll be telling something about all those things in the next few slides. And as professionals and as individuals, you can try all these things to be mentally strong, so that you have a good sense of emotional well-being and good sense of positive mental health. Okay, most of these things I guess have been spoken of yesterday, today, and day before yesterday, and also in the coming few days you will have nutritional specialists, you will have health specialists who will be speaking of how to take care of your mental health from different perspectives. But I, as a clinician, have told you the subtle signs which we should come out. Okay, one very important thing again to stress upon, that I have been telling people around when we go. Please stand up to the stigma. Do not stigmatize mental health. Do not discriminate people who are suffering from some mental illness. There has been a lot of negative attitude, negative beliefs, negative criticisms being given if someone is suffering from mental health. That is why they fear, people who are suffering fear and to seek help and come to us as psychiatrists to seek help. This mostly happens with the educated lot. There were examples I'll tell. There was a patient from a very high profile bureaucratic family my dad is also a psychiatrist. He called up my dad and he started having a chat that I want to go to your clinic because I want to seek help from my daughter who is having some problem in her studies. She cries a lot, but I won't go through the front door because what will people say if I go through under the banner of a psychiatric clinic? So do you have a backdoor entry? So that is what stigma is. People fear to seek help. People are ashamed to seek help from psychiatrists. They fear that, yeah, he is going to a doctor who treats mad people, who treats lunatics. Those mad people, those lunatic term have been now being abolished by the Supreme Court of India. We cannot call a person who is suffering from any mental illness as a lunatic or a mad people. Okay, so you need to be aware of all these symptoms, and please come out and seek help. Just break the shackle of stigma. Your stress, your depression stems from brain. The brain is the organ which I have already described in the earlier part. Brain is the organ. Likewise, when you have a fever, you have a bad stomach, you have a fracture in your hand or a leg, you will definitely go to a doctor to seek help for your physical problems. Likewise, your mental health is also of utmost importance. Your brain can also sometimes not work properly. Then it's not the time to get ashamed and get cocooned in a shell and go under the bed and hide somewhere. But again, come out and seek help from mental health professional. That is how stigma will end. That is why awareness is needed, that yes, these are the signs. And it's very well very easily said, and you need to change. Many of the students come to us, many of the children come to us and complain about your parents that they give us everything. They give us money, they give us cars to go to tuition, they give us expensive gifts, but they fail to understand us emotionally. Okay, I have been telling, one of my patients came to us. She is currently doing her undergraduation, and then she had 3 suicide attempts. Then she came and complained to us that I have been suffering from all these symptoms from class 8 since the last 4 years. But my parents tell, yeah, you are a coward. You should solve your problems on your own. But that is not the issue. Many of us cannot solve our stressors on our own. We need to seek help professionally. So just merely telling and merely not seeing the problems of others or your family members is not the problem. You should come out and seek help. That's why we should always break the shackles of stigma, right? That's why last 3 to 4 years ago, WHO, World Health Organization, every year celebrates or observes the World Health Day. 3 to 4 years ago, they gave the theme. Every year they have different themes. On some years it might be on AIDS, on some years it might be on malaria or hypertension. 3 years ago they gave they gave the slogan of let's talk about mental health. Why let's talk about mental health? It was seen that although many people are suffering from mental health disorders, although many people are suffering from common mental health disorders like depression, anxiety, most of the people do not seek help. Only it is found, if I give you the statistics, throughout the world only 19% seek help. The rest 20 or 70% do not seek help, and they internalize, they keep their problems within themselves, and it leads to one another problem and ultimately also the suicide. So WHO came out with the slogan that let's talk about mental health, break the shackles of stigma, come out, communicate, speak. So mere speaking and mere ventilating the thoughts can help a lot and can help a lot to the person who is suffering. If you see someone with all those symptoms, just go to him, just ask him why you are behaving in this way. Is there anything that is supposed to disturb you? Is there anything that is supposed to disturb you which I can help you out? Or if you need some help, I can take you to a professional. Please speak up, please communicate. That's why World Health Organization came up with the slogan, let's talk about mental health. And we strongly believe that counseling or mental health therapy can start. You do not need any specialized training, you do not need any specialized um, certificate course to start counseling. It can start right away at the bedroom, it can start right away at the hostel room, at your staff room, because it says that mere ventilating, the person who is suffering, if you can ventilate his thoughts, if you can ventilate his emotions, that decreases a lot. Okay, so there is a beautiful video in YouTube. If you people can see, it's known as Dubara Pucho. That again was released 3 years ago when this slogan came. It means a person might not tell you if someone is suffering. He might not tell you at the first go why he is behaving like this, why he is crying at times, why he is irritable. So you keep on asking him, एक बार नहीं तो दोबारा पूछो, दोबारा नहीं तो और एक बार पूछो. That's what the slogan goes. And ultimately, you will see if you can confide in him your confidence. Most importantly, the confidentiality. Then if you have believe and build the trust in him, then definitely he will speak, and that speaking and ventilation will help a lot. So that's the slogan of what we mental health professionals nowadays very much give importance on. Let's talk about, let's come out, let's talk about depression or mental health. Okay, so there is always a light at the end of the tunnel, so we must always hope for the positive things. And one important thing I like to tell that we need to be happy in whatever field we are working on, because this is a beautiful statement by John Lennon, one of the Beatles guys. He had dyslexia, he has learning disability, so he was not very good at studies like Einstein. So when his mother always used to tell him that when I was 5 years old, my mother always told me that the happiness was the key to life. When I went to school, they asked me what I wanted to be when I grew up, and he told that I wrote happy. The teacher then told, you did not understand the assignment. In reply, he told, you did not understand life. So ultimately, in life, it all boils down to how happy you are. And we as mental health professionals stress on the point that happiness is the key to success. Success is not measured by us on the terms of monetary value, but at least how happy and how satisfied and how content is someone is in life. Okay, so my dad is also a psychiatrist. We all three have our own trust known as Mon Niramoy. We give all these awareness programs, awareness activities. We have been doing it virtually since the last 6 months, but when obviously we go out to colleges, schools, we do workshop on parents and teaching teachers and students also, and we try to give whatever little awareness we can so that it will be helpful for others. And we strongly believe in our tagline, healthy mind for healthy society. Thank you all for the patient listening. It's 3:30 now. After 5 minutes break, I'd like to present the Jayashree part, just a brief of how to take care of your emotional well-being and emotional uh, and positive mental health, the part which she was supposed to present. But I'll just do it in a brief, because most of the things it will be covered in it has been covered in some of the topics that you had already attended in the last 2 days, like the resilience factor, and some of the topics which you will be attending in the few coming 2 days, like yoga, meditation. Obviously, those are all very holistic way of how you control your stress and how you have a set of positive mental